Hello guys, welcome to my channel. In this video we are going to see about the ligaments of the knee joint. So what you're seeing here, this green shaded thing, this is the fibrous capsule of the knee joint. So this fibrous capsule is very thin and it is deficient anteriorly, which is replaced by the patella, then the ligamentum patellae. Here you can see this is the ligamentum patellae on the lateral side and this is the ligamentum patellae on the medial side. Then it is also replaced by the quadriceps femoris. Hope you all know what are all the contents of the quadriceps femoris. One is vastus medialis, vastus intermedius, vastus lateralis and rectus femoris muscles. So the fibrous capsule, it is anteriorly deficient. So here you can see it is anteriorly deficient, which is replaced by the patella and then by the ligamentum patellae on the lateral and also on the medial side, then by the quadriceps femoris muscle. So now coming to the attachments of the fibrous capsule. So fibrous capsule, above it is attached to the femur and below it is attached to the tibia. So now let us learn briefly about the femoral attachment and the tibial attachment. In order to have a clear view, I am just isolating this fibrous capsule. Now coming to the femoral attachments. So the fibrous capsule is attached to the femur above half to 1 centimeter above the articulation between the tibia and the femur. And this attachment of fibrous capsule to the femur has 3 important features. I'll first mention that, then we will see one by one. Of course, we know anteriorly it is deficient. And it is replaced by the patella. Then ligamentum patellae. And then quadriceps femoris. Then coming to the posterior feature. So posteriorly it is attached to the intercondylar line. Now coming to the next feature, laterally it encloses the origin of the popliteus muscle. So these are all the 3 main features. Anteriorly it is deficient and of course it is replaced by the patella, ligamentum patellae and quadriceps femoris. Then posteriorly it is attached to the intercondylar line and laterally it encloses the origin of the popliteus muscle. Let us see one by one. So as I already mentioned, anteriorly it is deficient and it is replaced by the patella. So here you can see this is the patella and this is the ligamentum patellae on the lateral side and this is the ligamentum patellae on the medial side, and then it is also replaced by the quadriceps femoris. Coming to the second feature, so as we saw, posteriorly it is attached, the fibrous capsule is attached to the intercondylar line. Here you can see the intercondylar line of the femur. See here, this is the intercondylar line of the femur. So the fibrous capsule gets attached to the intercondylar line of the femur on the posterior side. Now you can clearly appreciate how this fibrous capsule is attached to the intercondylar line on the posterior side. So this is the intercondylar line. The fibrous capsule is attached to the intercondylar line of the femur on the posterior side. Now coming to the next feature. So on the lateral side, this fibrous capsule encloses the origin of the popliteus muscle. So here you can see this is the popliteus muscle. So it encloses the origin of the popliteus muscle. So this muscle, this popliteus muscle, takes its origin from the groove for the popliteus. So this fibrous capsule encloses that groove so that the origin of the popliteus muscle is also under the cover of the fibrous capsule. So these are all the 3 main important features of the femoral attachment of the fibrous capsule.